But let's talk about your symptoms before the
My,
surgery.
my symptoms before the surgery is number one, I had to have a shopping cart, a walker, or something to lean against because I had these shooting pains in my legs, both legs,
Okay.
and I also had a foot drop in my left leg. And
Let's talk about the back pain you just described to me. 1 to 10, how bad was it?
it was to the point to where the shooting pains going down my leg would cause my leg to absolutely drop off from underneath me.
1 to 10, how bad was that pain?
12.
12. Okay, that describes exactly what's really going on.
That's where it was
Yeah,
at. I mean,
yeah.
it was just absolutely terrible.
Yeah.
But the
How many years did you have that symptom?
well, I would say solid symptoms of that was the last 2.5 to 3 years.
2.5, 3 years. When was that previous surgery? What year?
About 4 years ago.
4 years ago.
Yes.
Yeah,
Yeah.
about 4 years ago, and then of
And a
course the
stimulator a year ago.
Yeah.
yeah.
So let me just, put it in a short version together. You had symptoms there, and they did a surgery, and it didn't remove the pain, so they had to put a spinal cord stimulation device in, but that device as well was not working,
Right.
and the pain was off the scale.
Off the scale.
And
Even with the device.
even
on.
with the device on.
Yeah.
And how long could you stand up before pain stopped you?
Not long enough to shower.
Not
and not
5
long
minutes,
enough to
yeah.
get from recliner to toilet.
Yeah.
Just barely.
Yeah.
Just
Legs
barely making it.
buckling.
And-
He's had some falls.
Yes, and you had a literally loss of function in your left foot, and tell me about it.
He-
I would say that I lost function in both legs
Yeah.
because the
But-
right leg mainly pain, left leg pain, and then the.
But you couldn't
motor
move the
action.
leg.
I couldn't move my left leg. I
Okay.
drug it.
Done before. Now you're not about a year after the surgery. You are just about
1 month.
1 month after the surgery.
Yep.
Would you mind, both of you, actually describe how is your life, how are your symptoms since the surgery for me?
Well, first of all, no pain.
Good. That's important.
Second thing is.
That pain
I'm-
of 12 is gone.
Yeah, the pain of 12 is gone.
Good. When did it go away?
Yeah.
How long after the surgery did that pain go away?
Well, as soon as I woke up after surgery,
Excellent.
it was
So,
gone.
Yeah.
He
Yeah.
walked the nurse's station floor multiple laps
Yeah.
within hours of surgery.
Within hours after surgery.
Yep.
But this is just 1 month after a 3-level fusion surgery,
Correct.
which I'm going to turn around here. Here is what we did. We did a 3-level fusion. In the levels that were mostly symptomatic, we have other problems there, but we didn't try to fix all. We tried to fix those levels that are mostly symptomatic, and we put screws. Here are the screws. They are all in perfect position, and the spacers are all, and all of that with a minimal invasive procedure. And I'm going to turn around to our record. Our surgery was 91 minutes, and our blood loss was 52 cc, which is practically nothing for this kind of surgery.
No.
We could achieve all this result with a 1.5 hour surgery, whereas open surgery for a 3-level has been at least 3 times longer, at least
I believe that.
His
having
last facility said about 8+ hours.
8+ hours
The way
for
they
this.
would have done it.
Yeah, with the open old-fashioned surgery.
Yep.
Did I tell you about how long you would have stayed in the hospital after that
I
surgery?
don't recall.
I don't think they set a time, but they refused to do the procedure because of the length of time for the
That would be,
anesthesia.
that would be too much for
Too
him.
much.
Yeah.
yeah.
How long did you stay in the hospital after our surgery?
We stayed 2 nights, and we had to stay 2 nights because of weather.
Weather, okay.
Yeah, we stayed. They wouldn't let us go because of the weather was.
So you were ready to go one day after, but
Absolutely.
Yes.
yeah, okay. Well, this is the best. There's another thing I want to talk about, and that is that when we opened up the space, between the 2 bones where the nerves are coming out. Some of the nerves were obviously damaged, and that part will take about a year for those nerves to recover. But part of the nerves, they were falling asleep. That is why you have, after a month, they're getting the function back. Those are waking up. Now, when nerves wake up, like when we lay on our arm and then we move it, and then we have that zinger going down, the tingling and so on. That is how nerves behave when they are waking up. You told me you have some of that symptom. Describe it to me.
Well, the only time I really notice it is when I'm on my back or on my side in bed. And then I get up,
Mm-hmm.
and then I roll out of the bed. And when I'm rolling out of the bed and I'm kind of getting my body up,
Then you get
I
those
get a little
fingers.
kind of a shock through my
Yeah,
leg.
yeah, that is.
Yeah, just a few little shocks, and then once I sit on the edge of the bed, it goes away.
Okay, that is actually the sign that those nerves are waking up.
Okay.
That's how they behave. So that's in a sense is a good sign of nerves coming back to their normal function. Now, overall, are you happy so far with the procedure and the results?
Oh, you want to kiss, Doc?
Well, thank you. Yes, well, just you saying that is the biggest compliment any surgeon can get.
I want
Yes.
to add one more
Yeah.
thing. Ted was having some incontinence before,
Mhm.
and he is not now.
Correct.
And
But
they kind of were blaming different other health issues, but that's
that is
gone
yeah, if
now,
that's
and
gone, that's
so
a proof
it
that
was
that is the
probably
function of the
from-
nerve.
Yeah.
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 So we
we're
are very happy with the results. We have we are just 1 month out.
Right.
So we have a long way to go, but this is as good as it can get after a month. After a surgery that other places they told you it's 8+ hours, and it's so dangerous that they don't want to even
Right.
do it for you.
Right.
They didn't doubt that you need that. They just were saying the surgery would damage you more because it's so invasive. So, and that we could achieve that result in a 1.5 hour surgery with 50 cc of blood loss.
Nothing.
I think no other surgery can really achieve this result.
Right.
We're
beside
very,
this.
very happy.
Well,
Very
thank you
happy.
so much for the
Thank
interview.
you.